Med breakdown. Thrive with medicine. Vitals assessment and triaging. Vitals. Vital signs measure your body's basic functions. They're the first step of any medical exam or evaluation. In an emergency setup, these vitals are also used for triaging of patients along with assessing and monitoring the progress of the patient. They mainly include: pulse, normal value is 60 to 100 beats per minute. Blood pressure, normal value is 90 by 60 mm of mercury to 140 by 90 mm of mercury. Respiratory rate, normal value is 12 to 16 breaths per minute. Temperature, normal is 97.8 to 99.1 degree Fahrenheit. Oxygen saturation, normal is greater than 95%. Blood glucose, normal value is 110 to 140 mg per deciliter. Pulse less than 60 is bradycardia and more than 100 is tachycardia. BP systolic less than 90 mm of mercury is hypotensive and systolic more than 140 mm of mercury is considered hypertensive. Oxygen saturation less than 90% is considered hypoxia. Respiratory rate less than 12 is considered bradypnea and more than 16 is considered tachypnea. Temperature less than 97.8 degrees Fahrenheit is considered hypothermic and greater than 99 degrees Fahrenheit is considered hyperthermia. GCS assessment. GCS is used to assess the level of impairment of consciousness of the patient. These mainly include three components. They are motor response, verbal response, and eye movements. When we look at motor response, if there is no response for a pain stimulus, then a score of 1 is given. If there is extension response for a pain stimulus, then score of 2 is given. If there is flexion response for a pain stimulus, then score of 3 is given. If patient withdraws from pain stimulus, then score of 4 is given. If patient can localize pain stimulus, then a score of 5 is given. If patient can obey given commands, then a score of 6 is given. So the maximum score that can be given for a motor response is 6. Now we look at verbal response. If there is no verbal response, then score of 1 is given. If patient makes incomprehensible sounds, then a score of 2 is given. If patient speaks inappropriate words, then score of 3 is given. If patient is confused, then score of 4 is given. If patient is completely oriented and speaks appropriately, then score of 5 is given. So, the maximum score then can be given for verbal response is 5. Now we look at eye opening. If there is no eye opening even with pain stimulus, then score of 1 is given. If there is eye opening to pain stimulus, then score of 2 is given. If there is eye opening on verbal command, then score of 3 is given. If there is eye opening spontaneously, then score of 4 is given. So, the maximum score that can be given for eye opening is 4. Normal GCS is described as M6V5E4 and a total of 15. GCS interpretation. GCS score of 15 is considered conscious patient. GCS less than 8 is comatose patient and an indication for rapid sequence intubation as there is loss of gag reflex. GCS less than 3 indicates that patient is completely unconscious. That is, even a dead patient has a GCS of 3. GCSP score. GCS minus pupil that are not reacting to light. For a completely unconscious patient, GCS is 3. If 2 pupils are non-reacting to light, then the GCSP score is 3 minus 2 is equal to 1. Similarly, if one pupil is reacting and the other is not, then the GCSP score would be 3 minus 1 is equal to 2. Triaging. Simple triaging is the preliminary assessment of patients or casualties in order to determine the urgency of their need for treatment and the nature of treatment required. Then the patients were assigned colored tags based on ABCDE. A is for airway, B for breathing, C for circulation, D for disability and E for exposure. Patient is categorized red if there is airway obstruction, or oxygen saturation less than 80%, or respiratory rate is greater than 35 or less than 8 and heart rate greater than 130 or systolic BP less than 80 and GCS less than 8. Patient is categorized yellow if there is threatened airway or oxygen saturation between 80 and 89%. Respiratory rate between 31 and 35. Heart rate between 121 to 130 or less than 40. Systolic BP between 80 and 89. GCS between 9 and 13. Temperature greater than 40 or less than 32 Celsius. Patient is tagged green if airway is normal and saturation more than 90%. Respiratory rate between 9 and 25. Heart rate between 50 and 100. GCS 15 and temperature within normal range. The patients who are tagged red needs to be addressed immediately. The patients who are tagged yellow are to be addressed after red as they aren't life-threatening. The patients who are tagged green can be addressed later on comparatively safer side. Black tag indicates dead or deceased individuals. In a disaster or mass casualty situation, different systems for triage have been developed. One system is known as START, Simple Triage and Rapid Treatment. In START, victims are grouped into 4 categories, depending on the urgency of their need for evacuation. If necessary, START can be implemented by persons without a high level of training. The categories in START are: the deceased, who are beyond help; the injured who could be helped by immediate transportation; the injured with less severe injuries whose transport can be delayed; those with minor injuries not requiring urgent care;